My name is Caroline Labouchere. Welcome to my YouTube channel. I've got my dermatologist here, also my best friend. And we're going to be talking today about hair loss.
And yours is looking just...
Well, thank you very much.
Yeah.
I don't have, I think I probably just have normal hair loss. I think it's thinning at the front, but it is, I don't stress about it. But so many people stress about hair loss. Tell me.
Yeah, it's like one of the top probably 5 things I get coming into my clinic is women who talk about hair loss and are worried about hair loss. And it comes from a really early age. Like I have late 20s, early 30s, women all the way up to 50s and 60s. So it's a huge variety of women who are affected by this. And if you look at stats, about 50% of all women will at some point in their lives complain of hair loss. 50%.
And they get really upset about it too.
Oh yeah, it's like, it's devastating for many women. So even what I would consider relatively objectively mild hair loss, like what you were describing, like a bit of thinning around the top of your hair, which most women or all women have less hair density at the front of their hair than they do at the back of the head. That's normal, like that's the normal way your scalp is. But yeah, so even
throughout life.
Throughout life. So most women will have, less, and you'll notice that with your parting and stuff. Oh, my parting, you can see my scalp a little bit. That's normal. That's pretty normal. So what you're describing, I wouldn't consider pathological. You have normal kind of mild hair thinning. We all have that. So yeah, so it seems, well, that's a good question. It does seem like some people get more hair loss at certain times of year, but I think the first thing to think about in this is what the hair cycle is.
Right.
Because I think getting the terminology right is really important here. So you have basically 3 parts to your hair cycle: anagen, telogen, and catagen. They're not in that order, but that's fine. So the anagen hair part of the cycle, the anagen cycle, that's your hair growth, okay? So about 90% or 85% of your hair is in anagen at all times. So your hair is growing all the time. And most hair follicles on average are in anagen from anywhere from 4 to 7, 8 years. So, and that's kind of genetically programmed as well. So if you just let your hair grow and never cut it, it would get to a certain length because that's your preset kind of anagen growth. So once your hair has gone through anagen...
That's interesting, because people say to me, my hair won't grow longer than this.
Exactly.
And you just say, really?
Really?
And that's a fact.
Yeah, just blame your parents. So it's your genetics. So, I mean, I don't know how much longer your hair will grow if you were to continue
It does
grow.
get
grow.
Yeah.
I think my hair would too. I have pretty long hair, it's kind of like your length. So I think my hair would continue to grow. So anagen is your first cycle, your first bit of cycle. That's your growth cycle. So loads of your hair are in anagen. That's the most common place for it to be. Then it'll stop growing, go through a rest phase. And then after that, it'll go through a shedding phase.
Okay. So you've got 3 phases. So then you have a period. So okay, so my hair's grown.
Yeah. Then it rests.
Stops.
Yeah.
Then it falls out.
Yes.
But this is rotating the whole time.
Yeah. So
you've got a zillion hairs growing.
Yes. And the fall and the rest and shedding phase are like 2 to 4 months at a time, and then the shedding phase is like 4 weeks. So you constantly have your hair cycling. So it's going through, just like with dogs.
She wants
to go on my lap. Okay, so it's going through cycles all the time. So it's going through growth, which is the longest phase, then it'll go through the resting phase, and then at some point the hair will fall. And it's very well understood, like this hair cycle has been researched to death, and like we understand, how it happens and the molecular mechanism behind hair shedding. So you're constantly shedding hairs, okay? So some of your hairs will always be in a telogen or a catagen phase, which is like the rest or shedding phase. So it's normal to lose anywhere from 50 to 100 hairs a day. If you have longer hair, it'll look like it's more because you have more hair, like it's longer.
Right. Yeah.
Yeah, so that's the basic premise behind the hair cycle. So when someone starts to lose more hair than they think is
what's more hair?
Oh, sorry. Well, that's the question.
That's the question.
Well, that's the question. So it's extremely subjective. So when I have a patient coming in saying, I'm losing my hair, it's like, right, okay. So what exactly do you mean by that? Are you getting lots of hair in the shower more than you think is normal for you? Is it coming out your hairbrush more than you thought was normal for you? So it's incredibly subjective. And so it's about me asking that patient the right questions to understand, are they just becoming more aware of their natural hair fall, or is this actually a pathology? Which is kind of the biggest issue.
So somebody comes to you, they say, I'm losing my hair. They say it's traumatic, it's
Yes.
falling out.
Yes.
What do you do?
So the first thing I do is I take a history. So I ask them, how long do you think this has been going on for? Do you have any medical problems? Do you take any medication? And then I take like a timeline of their medicine and their like history. I'm like, well,
The medication
history.
Right.
What about stressful life events like moving home, moving countries, changing jobs, deaths in the family? Like, let's timeline that out. And how about children? Have you had children? Let's timeline that out as well.
Divorce,
anything,
yes.
traumatic, anything really. I mean, there's lots of changing jobs.
But
there's
would
lots of
people
stuff.
believe you if
No.
you said it's all of that?
Potentially not, until we dig down into the history enough where we can kind of almost exactly pinpoint a 3 to 4 month window that happened after a certain event. Because that's usually where I'm trying to aim for. So, like right now with COVID, I had COVID 6 months ago. I started losing my. There's lots of COVID hair loss. 3 months later, I lost my hair. And then there's lots of medication things, like I stopped taking the contraceptive pill 4 months ago, and then I started shedding hair. So that's a really common association.
Started HRT or
Yeah, so usually that doesn't cause hair loss.
no, but you've got the hair loss
Prior to that, the hormones.
Okay.
So it comes. So it's really about like me being a Sherlock Holmes and putting on my investigator hat and really kind of asking the questions
Yes.
and digging around a bit in your personal life to figure out what where are we hitting? Like, did you go through IVF? And people miss things in their history, so I have to be very specific with my questions. So I usually look for a 3 to 6 month window of anything happened before that
Okay.
to kind of judge
But
where
not
we
years
are.
before.
Not usually years, unless it's been going on for a long time,
Right.
and then I look for years before.
Right.
So then that's the history part. So getting all that information, and then it's about looking at the scalp. So I look at your hair, and I look under my dermatoscope.
You've never looked at my
I've never looked at your scalp because you never actually complained of hair loss. Caroline has never come to see me in any capacity to talk about hair loss. It's never happened. Hair loss has never been so many other things. But hair loss isn't one of them. So I've never looked at your scalp properly, but there isn't really a
But
reason.
it is important to other people, that's why we're...
Yeah, it's important to other people. So I look at the scalp, so I'm like, all right, is there evidence of scarring hair loss? So because the first, most important thing to me to differentiate is this a scarring hair loss or a scalp disease? Like, do you have a disease of your hair follicle? Or is this age-related, hormone-related hair loss? So in my head, if I have to separate the two immediately, because we go down totally different paths once it's one or the other. So I don't know if we want to talk about all those weird and wonderful diseases that give you scalp disease, scarring, hair loss.
I think they can come and see you.
They come and see me for that. But there is a whole world out there. If you have really patchy hair loss, so I'm just going to give you some red flags. So really patchy hair loss, lots of redness or itchiness of the scalp, where you have patchy hair loss associated with that, really thick scale on the scalp, any kind of like funky kind of feeling stuff on the scalp, those can all indicate a scalp disease or a hair follicle disease. So then you would want to see a dermatologist like myself or someone else who knows how to look at hair and scalp to differentiate if you have an actual scalp disease. Like, and I'm just gonna reel off some names here, like frontal fibrosing alopecia, central centrifugal secretional alopecia. You have things that happen more in men, like folliculitis decalvans, dissecting folliculitis. So these are all like serious scarring hair loss problems that need to be managed pretty urgently to get the hair to hopefully not go too quickly. So those are your kind of scarring hair loss, and then your non-scarring are your alopecia, so alopecia areata or tertalis. So when people have coin-shaped patches of hair loss, or they lose all their hair suddenly. So those are all diseases of the scalp, and like when they have chemo-related hair loss, things like that. But I think what we're mainly talking about is what affects most women, or a lot of women, is hormone-related, age-related, pregnancy-related hair loss, or medication-related hair loss.
We tested the water.
Oh, we did. We
might try and fit that little video in to this.
Yeah.
Because we did scientifically.
Very scientifically. We were wearing scientific outfits and everything.
Outfits and everything. We tested the water from London that you brought over.
From Heathrow.
And the Dubai water, and they were exactly the same.
They're exactly the same. So except the posh water was, what was it?
Voss.
The Voss water was very low in minerals. But you would expect that because it's, posh water, so they demineralize it. But
there is nothing wrong with
Dubai water. There isn't anything wrong with
there's
Dubai
nothing wrong with England water, but they're the same.
Correct.
Anyway, so
They're
it
the same.
isn't, categorically, it is not Dubai water that is making your hair fall out.
Correct, it is not the water. There's a lot of other things that can make your hair thin in Dubai, but it's not the water, so.
Swimming in the sea, is that going to affect
No,
it at all?
no, nothing like that. No, not usually.
Too much heat?
No, not too much heat.
Now, somebody suggested the follicle is being opened too much by living in a hot country.
No, follicles don't open or close. Just like pores don't open or close either. But pores and follicles, same thing. They're both hair follicle structures.
Yeah.
So no, hair follicles don't open or close. Not at all.
And pores don't open and close.
They don't either. They're not like doors.
No,
Pores are
doors.
Pores are not doors.
No,
So-
like that.
The only blood tests that I would ever do on someone with hair loss are ferritin levels. And thyroid function, yes, but most people have had thyroid function tests before they ever come and see me, so that's usually not an issue. But the ferritin, yes, because iron is a well-known cause of, or low iron is a well-known cause of hair loss, but it's specifically ferritin, so it's iron storage. And there is no magic treatment here. You just get your iron to be replete, so you just get it back up to over 70. So even though the iron values for most labs are somewhere between 16 and 150 or 200 is a normal range, for hair growth we like it to be over 70.
Right.
Yeah.
So that would be with food.
I prefer with food than with supplements.
Right. But you would also, if somebody says I don't know,
Vegetarian,
vegan
vegan.
or something, then they would take supplements.
Yeah, but iron supplements are difficult to take because they cause constipation.
Right.
And they also don't absorb well, generally. So
Right.
if you can get it
try and
from,
do it.
yeah, even vegans can get iron from food. Like
Right.
liver is a great, not a vegan.
Even vegans live
Even
on.
vegans eat liver. Liver, beef, no they don't. Liver, beef, and so on. Eating more red meat, even a couple times a week can just really help iron go up. The other thing it could be besides hormone related is an acute stress related hair loss, which we refer to as telogen effluvium. So that can be drug related. So telogen effluvium is just a funky Latin term that refers to any kind of hair loss that is triggered by some type of stressful thing. And that can be.
And that must be very common.
It's super common. Oh yeah, it's super common. Pregnancy is the #1 example. So that's why most women shed their hair or lose that fullness they get during pregnancy 3 or 4 months later. That's a classic telogen effluvium thing. The combined contraceptive pill does that to a lot of women. So stopping the pill can make them shed their hair more than normal. Some medications can do that. People think that Accutane or Accutane can do that. It's extremely rare if Accutane does do that, by the way, but it has never been shown to be anything but temporary. So if you do get a little bit of hair shedding, if you start a drug like Accutane, is almost certainly, it will be temporary, and I can 99% guarantee that, though I never say 100% for anything, but it is temporary.
What about male pattern hair loss in women? As in,
That's female pattern hair, yeah, that's the same.
yeah, but there's a male, because I met with somebody yesterday and she said that she had got it from her father who was bald. She said it's very rare that women get it.
Yes, so that's, okay, so having hormone related hair loss that's genetic, that comes from your father, that's not that uncommon. So when I ask people about their family history of hair loss, I ask for both the mother and the father.
What type of hair they have.
Yeah.
So if I said that my father was bald, that doesn't mean I'm going to go bald.
No, but if you came to me and you told me I have this kind of hair loss, and I decided or just diagnosed you as having female pattern hair loss, then I would ask you about your parents, and if you said my father also has hair loss, then oh, right, fine, then you probably got it from your dad.
Okay, can that be tested?
No.
Well, I might not take that as an answer then. No, that's not the answer, give me another one.
Yeah, no, you can't have that tested. There is no benefit from hormone testing in someone with hair loss. So I get this a lot. Patients come to me, they bring me this whole battery of hormone testing. I'm like, yeah, this is totally irrelevant because we know that women with female pattern hair loss have normal androgen levels. So, and it's not the level of the androgen, it's about your hair follicle sensitivity to that androgen, just like with acne. So the same things happen with acne patients. Acne patients get all these hormone tests which cost a fortune and are totally useless because they all come back as normal. And that's not because you have high androgens, it's because you're sensitive to them for some reason. There's some molecular thing going on with the hair follicle and the hormone which can trigger the hair loss. So do not waste your time or hope getting a bunch of hormone tests because it's not going to lead you down a path that is relevant.
Right. What about products?
Oh no, here we go. Products. All right. So for female pattern hair loss.
Yes.
Well, you use a prescription product. Well, you did.
Yes, I did, but the hair loss shampoos. There is so
Oh,
many
the shampoos.
hair fall products, they're called. No, that's not going to help.
No, so we all know what I think.
Is that not going to help at all?
No, not at all.
Why can you get stuff to make your eyelashes stay in for longer? Because that's what lash serum does.
Yes,
The hair stays
so
longer and grow for longer.
that's really interesting. So Vimatacross are what we use for our lashes. So, or Latisse, which is the brand name, is the FDA-approved treatment for eyelash hypotrichosis, so loss of eyelashes. It works well for eyelashes and eyebrows. It does not work for head hair. It would be.
Because I have thought about doing a little test.
You can do a test, but it'd be really hard for you to test that.
Yeah.
Yeah. So it's never been shown to help hair growth on the head. Though many
Whoever
people
comes up
have
with
tried.
that.
Well, we have minoxidil.
Yes.
And minoxidil works really, really, really well. It does. It works really
Minoxidil.
well.
Now you can buy that over the counter.
You can, or you can get it compounded. Obviously, I like my compounded one because I can add stuff to it to make it work better. But minoxidil is very effective. The thing is, and I did a big video on minoxidil, so it goes all into the nitty gritty about what minoxidil is, and you can watch that on my YouTube channel. So we can take a little plug there. So I did a 10-minute just explanation of how to use minoxidil, what it is, and how it works. The main thing with minoxidil is persistence.
Yes. And you have to use it forever.
You have to use it forever, and you have to use it for at least 3 to 6, if not 6 months, to really see an effect. And what is interesting with patients who use it is that they'll not believe me when I prescribe them the minoxidil, and I'll be like, listen, this is gonna help your hair. I promise, usually. And they start to use it, and then 3 months later, they're like, yeah, I'm still using it every day, I'm not really seeing an improvement. And then 6 months later, 8 months later, they'll come in for a follow-up, and we talk about something else. I'm like, oh my God, did you see my hair? My hair's grown so much, I can't believe it.
Wow.
It's incredible, and it's always something like an afterthought. Like, you start to use it, and you don't even realize you're still using it.
And how often do you have to use it?
Once a day. Well, it depends which strength you're using.
Because I did use it, and I was not one of those persevering people.
It's the foam, you didn't like the foam.
No, but I did notice that I had these
Baby hairs.
sprouting baby hairs. So something was working.
Yeah, something was
Every day?
Yeah, every day. But if you're really affected by your hair loss, then you will do it every day.
Right.
So so basically you can use it every day, and I also combine it with some finasteride topically and some tretinoin topically, and it does the trick. It does work, but it
Why
takes
do you
time.
add those other things to it?
Well, there's some evidence to suggest that if you do that, it enters the hair follicle better and can work better than minoxidil. So I mean, it does work really well. I get a lot of people asking me about oral tablets for hair loss. So there is some evidence to suggest that taking oral minoxidil and oral spironolactone, for example, can work for hair loss. So I do that too sometimes. It really depends on the patient. So I'll give them oral spironolactone, oral minoxidil. I have given oral finasteride to patients, which is a DHT inhibitor. That's licensed for men, so I would only use it for postmenopausal women for hair loss.
So you're gonna get hairy all over.
You can do with any of the treatments.
Even the hair minoxidil.
Not the topical. The topical, unless you get it all over your face, you shouldn't get it.
So if you're a hairy person, you don't want. I mean, if can you be a hairy body person and have hair loss and you're
Yeah, look at men.
Yeah, David's not very hairy.
No,
Okay, so
doesn't he wax those? He's a triathlete.
but now.
Oh my God! Should we get David to use minoxidil on his head?
I have thought about using the lash serum on his lashes.
It will work on his lashes.
He has such short lashes.
Does he? Should we do a trial and do half of David's head with 5% minoxidil and see if it makes half his head grow?
No, I don't think he wants
Yes, we
hair.
should do.
He doesn't want hair.
Should we do like a mohawk?
No, leave David's head alone.
If anyone comment below if you want David to have a mohawk.
No,
Dr. Spierings and his mohawks.
We're not doing it.
We'll ask him later.
Do you know what? I take my HRT,
Yeah.
the testosterone
Makes your
I
hair
use
grow.
on here, like this. Getting hairy here.
Yeah, so that's so interesting. I have another patient who told me that last week. And she joked and she was like, I'm gonna get a willy growing on my arm too soon. You're not. Yeah, testosterone gel makes your hair grow. Yeah, definitely. So, can you put it on your head and make your hair grow? I don't think so, but you can try it. But probably not.
Do I want to put my testosterone on my
And
head?
how do you dose? How much are you putting on there?
I don't know, 1-2 mils?
Like, do you squirt it out of a tube or something?
No, a syringe.
Oh, you squirt it out of a syringe. So that's really interesting because you're getting. So this is what you're getting here is terminal hair growth. So this is hormone growth. So this is what I would
There's a
expect.
different texture too.
Yeah, because as opposed to your vellus hair, which is
Yeah.
this hair. So yeah, I mean, this is funky. I can't believe you're getting this. You're getting it on both arms.
Yeah, because I put it on and I do that.
Can you find a part of your body where you wouldn't mind?
Well, that's what I was thinking yesterday, but where would I mind?
You know what I was thinking is maybe in the back of your head, like here. Because if you got vellus hair growth, terminal hair growth here, you wouldn't mind. So
No.
like,
Yeah.
so like,
Because
just
it
behind
has
your ear.
absorption good enough back there.
Yeah. There's no specific reason why you use put on your arms.
That sounds weird.
That is
I
weird.
just
You're gonna have to
noticed
laser. You're
that.
gonna have to laser that. Or
What is it not gonna? Is it growing? Is it not gonna go
It's not gonna
away?
go until you treat it. Yeah.
Oh, for goodness sake! Testosterone makes you grow
Hair, but that's why.
Only topically. I mean, only where it goes.
True. If you were to inject it into yourself, like what anabolic steroids, testosterone use, that would make you have gray hair all over. That's what finasteride or Propecia can do, sort of thing. Can give you hair growth as well. But I would suggest if you're
I'll
going to
try that.
use, you put on the back here because if you had more hair, because you have fine hair there, isn't it? Yeah. So I wonder if your hair would grow dark though, because it's dark.
Yeah.
Like she's not growing gray hair on her arms.
That's really scary.
I would just find an area.
Yeah.
I don't know where else you could put it.
I know.
Because you can't put it
That
like
one on your inner thigh. Can you imagine?
like a beard going on your thigh. Yeah, don't put your testosterone on your inner thigh.
No.
But things I was thinking, because when my patient mentioned this, like, okay, where can she put it where she wouldn't have hair growth? I mean, the only place in your body you don't have hair follicles.
Except
Palms and
my burn
soles.
finger.
Oh yeah, you have a burn finger.
Yeah, I have a burnt finger and a skin graft, and the skin comes from.
So your skin graft
yeah.
would grow hair.
It does.
Yeah, exactly.
I have a hairy finger.
You could have. You could have a hairy finger, but your palms and soles don't
Yeah,
have.
so don't use testosterone with never put it on my left hand.
No, but I left hand.
Otherwise it's going to be
But the only issue with putting it on your palms and soles is that the skin is so thick it might not absorb well.
Oh, right, no.
So that might not work. But like no one wants hairy toes, you know what I mean? So like where else could you put it? I would suggest back of the
That's a
neck.
great idea.
Unless you put your hair up a lot and you have like this tuft of.
Yeah. I hope you have more clarity after watching that video about hair loss. Please ask any questions. Keep asking questions. That's the only way we're going to get the answers. So write your questions below. Please subscribe because I have some more videos about hair loss coming along.